Are you craving salt, avoiding sweets, and carrying low? According to popular pregnancy myths, you might be having a boy, but how reliable are these old wives' tales, really? Hi, I'm Sarah Jennings, host of the Mama Method for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's exactly what you'll get here at Ubi Health. So today, we're diving into one of the most common curiosity-fueled topics during pregnancy. Can the symptoms you're experiencing actually predict your baby's sex? Now, I have 3-year-old twins, Chrissy and Hudson, and a third on the way. When I was pregnant with the twins, I fell down a serious Reddit rabbit hole of pregnancy myths. Some actually lined up with how things turned out, but most, completely off. Let's break down some of the most popular boy pregnancy symptoms you'll hear, and what the science has to say about them. First up, morning sickness. The myth says if you're not queasy in early pregnancy, it's a boy. But in reality, studies have shown that people carrying girls may experience slightly more nausea due to higher hormone levels, but these are subtle trends, not reliable predictors. Personally, I was sick morning, noon, and night with both twins. So yeah, didn't help me guess anything. Next, heartbeat. This one is everywhere. Supposedly, if your baby's heart rate is under 140 beats per minute, it's a boy. Above that, girl. While it sounds sciencey, the truth is there's no consistent evidence that fetal heart rate correlates with sex. Heart rate varies depending on gestational age and activity level, so it's really not a crystal ball. Here's a fun one, mood swings. Some say that if you're emotionally stable and glowing, you're having a boy. But if you're snapping at your partner one second and sobbing at cereal commercials the next, girl. Of course, mood swings are caused by hormone fluctuations that happen in every pregnancy, regardless of sex. What about how you carry? Low belly means boy, and high belly means girl, right? Actually, how you carry has more to do with your muscle tone, body type, and whether it's your first pregnancy, not the baby's genitalia. Let's talk cravings, the myth, salty or savory, boy, sweet or fruity, girl. In reality, pregnancy cravings are common, but they're driven by hormones, nutritional needs, and sometimes just being human. Now here's one myth I actually did try to track when I was pregnant with Chrissy and Hudson, the color of my urine. Darker supposedly meant boy. But let's be real, urine color is mostly about your hydration. The only thing darker pee predicted for me was that I needed to drink more water. There's also this idea of the linea nigra, that dark line down your belly. If it continues above your belly button, people say it's a boy. If it stops at the belly button, girl. But this line forms as a result of melanin changes and hormones, not the baby's sex. Hair and skin changes also get thrown in the mix. Some say you glow with boys and break out with girls. Honestly, my pregnancy skincare routine made more difference than which twin I was carrying. So, what does all of this mean? Here's the truth. These pregnancy myths are fun to talk about, and sometimes they may resonate with your personal experience, but they're not medically accurate ways to determine baby's sex. There's only one reliable method before birth, your provider's ultrasound or genetic testing. Still, it's totally normal to be curious. It's part of the magic of pregnancy. Just remember, there's no wrong or right way to experience pregnancy symptoms, regardless of whether you have a boy or girl. Every body and every baby is different. If you're currently expecting and wondering what other symptoms could actually mean something important for your health or your baby's, don't rely on myths. Instead, check in with Ubi Health's symptom checker at ubihealth.com. It's medical-grade, doctor-approved AI that can help you understand your symptoms based on real clinical data, like having a full care team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust. From pregnancy through parenting, right here on Ubi Health. See you next time.